The difference in medication distribution as far as being an X-ray tech versus being a nurse. My lady's a nurse, I'm an X-ray tech, and I could tell you off the rip, as an X-ray tech, you barely have any medications, any things you really do. The most part is like barium, gastrografin, some lidocaine you give to the RPA or the rad, like a cystograph sometimes. Like, you really don't deal with that much medication as an X-ray tech. Now nurses, you have everything. Nurse, the amount of drugs I've heard this from my lady of she's given or she'll talk about and she'll say, and then knowing all the side effects and all the things and then the dosage because they have to draw it up, and like it gets very, very hectic. And for them, the difference between any dosage and the weight and like how big it can affect the person, just a lot of liability over there. I respect nurses out there, couldn't be me. In my field, like they'll be like, how much gastrografin? Well, if it's a baby, you do a little bit less. Obviously there's a formula for that. And for adults, most adults, you just use the regular bottle, depending what kind of like contrast, if it's air contrast or if it's like the water contrast. Like, there's different types of contrast, and you have to know, like, the most liability we have, knowing if the patient's allergic to it, knowing like what to do if the patient has allergic to the contrast, and like kind of explaining to the patient the fluoro procedure you're doing. Compared to like the nurse stuff, that couldn't be me. But I respect all the nurses out there. Keep up your good work.